Troy, we're going to be starting in a second. Are we all good to go?
Thank you, Mr. President. Yes, we are live and recording. You may start when ready.
Okay. Just give us just, well, I think we have everybody here, so we will start seconds early if everybody is okay. First, I say let's stand for the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Mr. Pratt, agenda certification.
Thank you, Mr. President. Chris Pratt with the County Attorney's Office. All of the items on today's agenda have been reviewed by the County Attorney's Office and meet legal approval.
Okay, thank you. Are there any member disclosures for any items on the agenda today?
I have none, Mr. President.
None.
I have none. That's a no from Mr. Bracken, none from Ms. Morimoto. Okay. Let's move to the consent agenda. Has everybody had the opportunity to review the meeting minutes from March 9th? Are there any revisions or any comments on them?
I have none.
Everybody, the minutes are good to go as they are.
I am happy, Mr. President, if you'd like a motion
Yes.
to approve both the Douglas County Board of Health regular minute meetings from March 9th, 2023, as well as the May financial reports.
Excellent. And I assume everybody's had the opportunity to look at the financial reports. And if there, or is there any discussion or comment on those?
I have none.
We have a motion. Do we have a second?
I'll second.
We have a motion and a second from Ms. Morimoto. All in favor, say aye.
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 Aye. Opposed? Thank you. Let us move to our regular agenda. Director Hill, provide your director update, please.
Okay, so we've transitioned from being a work in progress to a working health department now. So we're like a grown-up, big boy, big girl, big person health department, to be correct, I guess. We'll be fully staffed. We have offers out to the last 3 employees, so June 1st we'll be fully staffed at our current staffing level. We're asking to increase it later in the agenda, but as of the level we set right now, we'll be fully staffed.
What is that level?
41 FTEs will be at June 1st.
Excellent.
Let's see. So I've been still keeping up with CALFO, the Association of Local Public Health Officials, on their policy committee, looking at legislation. So that job has ended now for the year with the legislative session being over. I went to Chicago to the American College of Healthcare Executives Congress on Healthcare Leadership, which was a pretty impressive thing. There were international personalities speaking. It was a good event. I've been in a lot of meetings, several meetings around fentanyl with law enforcement in the community, and I've been working with colleagues up in Denver to try and make sure that I'm on board with what's going on and trying to make sure that what the medical examiner in Denver is seeing is similar to what we're seeing here or ahead of us, because there's been some thought by some law enforcement agencies there's more of these problems than perhaps there actually are yet, but certainly things are getting bad and getting worse, and they're coming. Let's see. We did a lot of surveys for CDPHE, always fun. I continue to go to the Homeless Initiative meetings every month with Commissioner Layden and Commissioner Thomas is normally there as well. We started strategic planning. We got 2 members of the board and 1 board alternate that are coming to all those planning meetings. So we'll have I think, a nice strategic plan to show you in July. COVID-19 ends as of today, according to the president and the WHO. So I think I'm going to stop reporting to you because the numbers have been pretty stable for a while. Mm-hmm. Same thing with influenza and RSV. They really popped in November, but right now they're approaching 0. So no sense mentioning them until autumn when they kick back up again. see, future says we'll still be doing strategic planning. There's going to be a national meeting of the National Association of County and City Health Officials in Denver in July. So I'm going to be pretty liberal with paying for staff to attend that meeting because it'll be probably 5 or 6 or more years before there's another national level meeting that close where I don't have to pay travel. I just have to pay registration. And I want people to have the opportunity to participate in those big meetings and learn from colleagues from all over the country. Then I've got one other task. The budget office has noticed that we have been wildly accepting grants without bringing them here and having something on the agenda showing that I presented them to you. So I'm going to give you 2 tonight that we'd like to have you at least, by not complaining about them, say that they're okay to accept. In July, we'll be coming back with a big laundry list of the new CDPHE grants because their fiscal year starts July 1st. And once we get a cent from the Board of Health, we'll take them to the Board of County Commissioners and get them into the routine county process. So first is a Ryan White Early Intervention Services grant that covers like HIV testing for people who want it. That grant period is from 4/1/23 to 3/31/24, and the amount is $31,315. It'll cover pieces of Laura Larson's time and the health educators and various people as we're going around. We've had a bunch of people, got phlebotomy cards so that we can do testing on the fly when we're out in the public. So a small grant, but it's something that there's a need for in the county. Secondly, we have a ELC 2.1 grant, and ELC is Epidemiology and Laboratory Capacity. It's a CDC grant passed through the state, and it's kind of the tail end of our pandemic funding. It goes from 8/1/23 to 4/30/24, and that's $488,980.09. So if your board has no objections, I'd like to accept those grants on behalf of the county and work with the commissioners to get them into the budget system.
I'm fine with that. Thank you, Mr. Hill.
And in particular, I want to call it the Ryan White program is a really, really valuable program. It does provide, among other things, life-saving cocktail of drugs to people who are HIV positive. And it's something that when I was at the health department, we focused on because it was, if people don't get them, they die or potentially die. I mean, it's bad. So I think the Ryan White program in particular is really important. Could you provide a little bit of color on fentanyl and what you're learning and what's happening in the county? I'm sure commissioners Commissioner Thomas, I'm sure, is aware. But what is happening in the county with respect to fentanyl? And what have you learned? It's been something that's been on my mind, and so you brought it up, and it triggered in me.
So fentanyl is a growing problem here, as in everywhere in the country and probably the world. It was big in Denver, and it's working its way south as things tend to do. There have been, does anybody have a number of deaths? I'm looking at Rachel out there no. So anyway, we're having several deaths that can be attributed to fentanyl.
What is the profile of people who are, is it students? Is it, who is?
From discussions that I've been in, it's pretty broad. I've heard of teenagers, I've heard of homeless people, I've heard of older adults. There are people out there who go and get like pills from their friends, say, hey, I have a headache. They give you a pill. You don't know where that pill came from. It could be fentanyl. It's older people. It's kids going to parties where they have like big bowls of pills and hey, grab a pill and pop it, and they're getting fentanyl. We also, we've had the xylazine. I try to mispronounce that word every time. So there's some concern amongst law enforcement that that's rearing its head in our county, but there's nothing recorded. And I talked to the medical examiner in Denver, and she told me that in the last year or so, they've seen maybe 2 people with xylazine as a contributing factor. So that hasn't really reared its head here. But fentanyl is definitely in our community in a fairly big way, and probably emanating from the light rail station that.
Right. is there an intervention you all are planning? Or, because this is a little bit different than like marijuana, for example. I mean, people know they're taking marijuana, kids know it. Here, they're taking something that they think may be something else, but there's fentanyl in it and they die. And I'm wondering what an intervention on this looks like.
So we're going to be working in the information part of this. So there's two sides of messaging. On one side, there's law enforcement who are panicked because they think by just touching fentanyl, they're going to die, which is untrue. So we're going to be trying to do some calming messaging to them and making sure they have Narcan and that they have fentanyl test strips if they want them, to make sure they feel safe doing their jobs. Then on the other side is the information to the public about, hey, don't take a pill unless it came out of a bottle from the Walgreens with your name on it and it was sealed at the time. So we're going to be working, and Wendy from Communications is working with the Sheriff's PIO. We're going to do videos to get the message out and try and get messengers from, get young people talking to young people rather than some old bald guy from Michigan going out there and trying to tell kids they shouldn't take pills.
We're not going to let you talk about Mr. Pratt that way.
You from Michigan, Chris? No, okay.
Oh, sorry, my mistake.
But it's a messaging, because again, we're not a treatment. We don't do treatment in our organization. So, like with the Ryan White, we're doing testing to find people. With this, we're getting messaging out so that people understand the danger that they're in every day if they're taking pills or other substances. There's also word out there that some people are lacing marijuana with fentanyl. So there's all kinds of avenues to get into trouble with this stuff. So the messaging is going to be about being careful with whatever you consume.
So, a couple of things. One, as you all are working on the strategic plan, where does this rank on the areas that you're prioritizing?
This would fall under injury prevention.
Yeah, but I mean, where does it rank in terms of importance? Maybe you're still working on it. So
Well, we're still working on it, but everything in this strategic plan is important. They're not ranked in that way.
But at some point, you have to prioritize what you're going to do.
We'll prioritize when we get to the tasks,
Okay.
task level of the plan, which we are not at yet.
Okay, fair enough.
That will get into the prioritizing. But these are all the things that are very important that relate back to our public health improvement plan and the community health assessment of the things that are important to our community and what the community needs. And we're building out, goals and objectives and outcomes, and then we'll get into strategies to implement those goals and who's going to accomplish each of those strategies. So it's a multi-layered process.
And a final question, and I don't want to belabor this, but I do think it's important, and it's been on my mind. And you may not be able to answer this one. Why do who is putting fentanyl into pills and drugs, and why? Because it kills people. I mean, what's the motivation for doing that?
Money. So the people in Mexico who are, producing the fentanyl from components they get from China are selling that. So the more people they can get to buy pills, and they're cheap. This is an expensive drug. But if they sell, 10 million pills at $1 a pill, that's $10 million. So it's all about money.
Even though they're potentially killing the people that they want to be.
Well, there's 350 or so million people in the country, and it'll take them a while to kill us all off, I guess.
Okay.
It's kind of flippant, but
Yeah, no, I hear you, and I'm.
Yeah, and
Oh,
one
I'm
other
sorry,
thing
Dr. Fielding.
One other thing to add to this is that fentanyl is basically used for pain. And we have in this particular society a lot of regulations on doctors prescribing pain medications. And it's gotten to the point where we have pill checks on people when we prescribe these. How many pills every day? You have to bring it into the office at random so we can count it. And when you have that much restriction on pain medication, and fentanyl can be used for that, you're also driving a market to an extent from people who, if they had a legitimate channel that was not so onerous, might be using other things, and then it slops over.
Thank you for that
Yes.
explanation. And thank you. Again, it's an issue that's been on my mind, and so when you brought it up, it triggered it in me, some questions in me. Finally, with respect to, so it looks like COVID and the other sort of respiratory diseases that we have been worried about are in the decline significantly. And at some point, my understanding that was going to be the trigger for us to start talking about, quarterly meetings instead of every other month. And I don't know where that's at on your agenda, but I'll rely upon you to let us know when you think we should be doing that.
Well, I think, so I do need to keep the finance and budget people happy. I do need to come in July with all those grants.
Okay.
So at that point, if you want, I'll put something on the agenda about going to quarterly, and you can consider it as a board.
Okay. Well, I'm happy to come every other month, but I know preparing for these meetings also takes time, so it's a matter of value that we provide to you and the organization versus us needing to meet, so I'll rely upon you to tell us when you need us.
Yeah. Tonight wouldn't be the time because I do have things that have to queue up. But if I know it's going to be quarterly going after July, I can plan around that.
Knowing you well enough now, Michael, I would not force a decision like this, force you to make a decision like this right now. So
We'd adapt.
you would adapt.
We're a really
Thank you.
talented bunch of people here.
Is there any other questions from any other board members? Sorry, I didn't mean to.
I do have some questions, or just really comments. So, Mr. Hill, as I was reading through the packet, I saw little things that I think are important, and one of them that I saw here is the language line, that you were paying almost $4 for audio and almost $5 for video per minute, and you found a new service that's 78 cents for audio and 88 cents for video per minute. That is in Spanish. And I just think that these kinds of things that show you're reaching out to a broad group of citizens that might need your help, and that you're also looking at costs, I think is really important to everybody. And so I read that and I thought it was interesting. The birth and death certificates are bringing in over $10,000 a month, which I think is a significant amount of revenue. And I have worked personally with both Katrina and Talitha and found them both to be just very helpful, very kind. And they made a difficult task easy. So, and I've told you that before. So I've got lots of notes here, but on your section, those were the ones that I read. And I applaud that you are looking at sending more staff to the meeting that's going to be here next year or this year. I think it's always a good opportunity for staff to go to national conferences, because the amount of things that they can learn is, you can't even measure it. So thank you for being thoughtful of your staff and making that a possibility.
And I did want to point out, earlier on when you talked about the finance reports, if you notice, I would call out that we're running about $250,000 of revenues ahead of expenditures right now. So if we keep on that track, we'll come actually $1 million under budget. I'm not promising that right now, don't write that down, but that's what we're on track for right now.
I didn't want to jinx you.
Yeah, well, so now I jinxed myself.
That's really good. So that's good. What are you going to do with the $1 million? What is how? Because I mean, obviously it's $1 million and basically taxpayer dollars, and it should be handled prudently, as you're clearly doing, because we're going to have a surplus. But ultimately, holding it on to it forever is probably not, or constantly running $1 million surplus won't be isn't the right way to go. How do you manage for that?
Well, I mean, there's a couple things. First is that last year, between ourselves and the budget office, we kind of made this budget up pretty much on the fly because we didn't have any experience. So we budgeted a little conservatively so that we wouldn't run out of money. And I also have been working with facilities to develop a $600,000-ish plan to do some remodeling in our two locations to make them work better for what we're using them for, because neither of them was designed for the kind of building that we're operating. So, we'll be bringing that before the commissioners at some point, unless the county manager tells us we can't.
Would there be, and I'm sort of thinking out loud, and at some point, if there were, would fee decreases be in the realm of possibility?
So we're going to be doing a fee, and our fees are supposed to be based on our cost of doing the service. So we're going to be working this summer. We adopted Tri-County's existing fees just because, again, we had no basis. Now we have many months of work behind us. We're going to look at the fees, and if they are too high, we'll bring them down, or if they're too low, we'll bring them, or propose to your board to bring them down or up. But, I also want to be careful, so I'm saying, I'm bragging about being $350,000, underspent right now, but is that really going to last through the rest of the year?
Right.
We won't know that until
Right.
later in the year.
Yeah, that, absolutely fair, absolutely fair.
Did, if I may.
Yes, Mr. Bracken, please.
So were you able to begin tracking the results of, what was it, paramyocardia? Is that what we talked about last meeting?
We've not been able to get any traction on that because we're not in that part of the game. We don't have physicians, nurses. We're not a group that's going to be analyzing health conditions at that level. That would be more working with the state health department.
Okay. Well, if you can access that to the state at some point, when it releases, then that'd probably be just fine.
Sure.
Any other questions or comments? Mr. Hill, anything else you want to add? At the risk of bringing up more questions?
No, there'll probably be questions for me later in the agenda.
Undoubtedly. We have written reports. Does anybody have any questions based off of the written reports? I don't have anything burning myself. I'm very interested in the Cherry Creek Basin Authority, but I'm not going to ask a bunch of questions on it. I will maybe at a later point. Is anybody else?
So that is on the environmental health update that you're talking about, Mr. President. And as you can see, I had circled the Cherry Creek Basin Water Quality Authority. I used to sit on that board. I now am on the Chatfield Watershed Authority. So when I saw that, I was interested in why you were attending, or somebody from this department was attending the Cherry Creek Basin Authority. Who would that be that answer that question? Is that you? Or someone else?
Caitlin is attending, and I'm not sure I remember the threads of how she got there, so she can explain that to us.
But I felt like I was talking too much.
It's circled.
Hello, I'm Caitlin Gappa for staff. I am attending the Cherry Creek Water Quality Basin Authority. I can't remember the exact thing. For septic systems, because we do have quite a few septic systems within the floodplain, and we have a specific section of our regulation that does not allow new septic systems within the 100-year floodplain. So we just kind of provide our, I sit on the TAC, the Tactical Advisory Committee, and provide our input as far as public health and how septics can affect the nutrients within the Cherry Creek, essentially.
So that's an interesting concept, and I will just add that I've been on the Chatfield Watershed Authority since 2017, and there has long been concern that all of the septic systems that are around Chatfield are impacting the quality of the water. Just so you know, this year, the Board of Commissioners have approved or will be approving up to, I think it's $35 million in our ARPA funds to build a wastewater treatment plant, a system along 85. So this will be the backbone. So other communities can reach in and connect to that system and get off of septic systems. And we just finished the legislative cycle, and on Monday, we got a bill approved, Senate Bill 267, that will add up to $2 per car that go into Chatfield. And the purpose of that fund is so that we can bring in maybe $250,000 that would provide matching grant money. So we can apply for grants, and we can do different projects along stream bank restoration going into Chatfield, and looking specifically at what we can do to get more people off those septic systems, and if in fact they are impacting the water quality. So I'm not trying to add another meeting to your schedule, but since you're going to Cherry Creek, if you're interested in coming to the Chatfield meetings once a quarter, I'm not sure about those TAC meetings, you can get with me or someone can get with me, and let's see if that's something that would be of value to you.
Absolutely.
Because we would welcome your expertise and your input.
Great, thank you.
Thank you, Caitlin.
Any other?
No, and that's really important work, because one of the reasons, frankly, this jumped out at me is when in my previous life, we did work on the Basin Authority, particularly because the Cherry Creek was not in good shape with respect to meeting water quality standards. And typically it's because of, not typically, but one of the reasons because of days like today. You get a lot of rain and you get the flush into the system. And what you guys are doing, what the county commissioners are doing, what the commissioners are doing to actually do projects that will mitigate impacts like that is really important. That's one of the criticisms we had of the authority 20 years ago, was that they were they lacked those sort of projects that were designed to provide direct benefit to source reduction going into the Basin Authority. Are they how from your, because look, we have a responsibility, and it's a serious one, that if we have septic systems within the 100-year floodplain, that we need to make sure that those are appropriately designed. There's also an obligation to make sure that other sources are controlled as well. What's your experience? Is it being run well? Are they taking? Talk a little bit about what they're doing and how they're ensuring that the Cherry Creek is, in fact, being protected.
Absolutely. So one of the main focuses is stream reclamation and ensuring that phosphorus is being removed from the water before it hits Cherry Creek. So a lot of the stream reclamation includes revegetation, kind of reworking the stream bed to ensure that there aren't deep erosions. They install drop structures to ensure that it's not causing more erosion in certain areas. Currently, they're planning on doing some cattail harvesting, because the cattails can actually contribute to that phosphorus. And another thing they just presented was putting some kind of like filter bags. They have not bentonite, but something like bentonite in it, and it helps to remove the phosphorus, and then it's an inert, filter when they remove it, so it doesn't have to go to a hazardous waste facility.
Where are those located? Where are those filter bags?
They haven't put them in yet. They're just it's just something that they brought to the board last meeting. So, or to the TAC last meeting. It hasn't been brought to the board yet.
Would it be like on drainage, though?
Yep, so it would be in detention and retention ponds, and then also along the stream bed itself.
Okay.
Yeah, and they're incredibly beautiful, but they could be placed in locations that have higher phosphorus levels, but wouldn't be impacting like the public's enjoyment of the stream. So I think it's being run well. They have a lot of really interesting plans, and they always have good new projects to remove phosphorus. They always account for how many nutrients they're removing, and then they kind of equate that to a dollar amount.
I was just going to point out that Cherry Creek is funded differently than Chatfield. Cherry Creek not only has mill levy on property owners that are within the Cherry Creek Basin, but there's also dues that Douglas County provides, I believe, quarterly to Cherry Creek, whereas with Chatfield, Douglas County pays $65,000 or $75,000 a year, matched by Castle Rock, and I think Jefferson County pays $35,000. And we have about 17 other volunteer members that pay voluntary dues to fund protecting the water quality in Chatfield. And that's why this year we felt that we were forced. We did a 20% increase in our dues last year for all the voluntary members. So that's why we went to the legislature and tried to get Keep Colorado Wild money, but the governor is absolutely opposed to anybody getting any of that revenue. So that's why we felt we had to impose this fee, because we have to be able to get some money for matching grants. So I have a couple other things for Caitlin. I would just like to point out that I found some really interesting things when I was reading these documents, and I think it's important for the public to hear this. Environmental health is fully staffed and fully operational. We continue to inspect retail food establishments and work through the backlog of 365 overdue inspections left by our predecessors. We have also found 13 unlicensed facilities, brought them into compliance and licensed them, and we have encountered several restaurants that haven't been inspected since 2019. So that was before COVID in 2020. So here we were paying Tri-County Health more than we're paying now, and yet this was the backlog that you all found. So Caitlin, are we caught up?
We are not caught up yet. We are working through the backlog. It's taking a little bit more time, and just with getting everything staffed and having people, kind of diverting their attention away from routine inspections to things like creating policies and paperwork. But we are actually really working towards that, and we're hoping to be through the backlog by the end of July.
And this wasn't meant to be a criticism at all. I think that you all have done a yeoman's job in creating a new department, because I don't think there was a how-to book to do this. So you've gotten it done, and yet you're taking care of what's going on now and working into the future. I have one other question. It says here that multiple environmental health staff attended the Colorado Zoonoses Conference. What is that?
So it's zoonoses, and it's actually epidemiologists attended too. It's one of my favorite conferences. It happens every year, and it talks about the diseases that can occur between people and wildlife, or people and animals. So zoonotic diseases are ones that are spread between animals and people. Because Douglas County has such an urban wildlife interface, I would say, we tend to see a lot of zoonotic disease, including but not limited to rabies, West Nile virus, tularemia, plague. So those are just some of the examples of the diseases we like to keep our tabs on and learn about during these conferences.
Thank you, Caitlin. So those were the comments or questions I had when I read the environmental health update. So thank you for everyone's time.
Yeah, thank you.
Thank you very much. I appreciate it. Any other questions from any other board members? Any questions for anybody else? They're all sitting there waiting to be called up anxiously.
Well, let me see here. I've got a whole bunch of copies
Thank
of things I printed off.
Mr. Surback didn't wear a tie today, so I'm not going to call him up.
Community health update. Is that Laura? Again, this is more for putting things on the record, just so the public, if they're interested in listening in, can see the work that you're doing. So I'm looking at this report that was in the packet, and it talks about that the clinical services you have provided are to 15 unduplicated individuals. Would you like to talk about a little bit about this work? Because I think when we contracted, or when you contracted with Stride, some people thought that we weren't going to be able to meet the needs of our population. So could you talk a little bit about what you have found the needs in this particular area are?
I'd be happy to, Commissioner. So the clinical services is being provided by Stride Community Health Center, which is a federally qualified health center here in the metro area. And the primary population that they intend to serve is individuals who are uninsured, low income, could be on public health insurance, and they also accept privately paid insurers as well. What we found so far is that there hasn't been this overwhelming need for clinical services. We do get a lot of calls in regards to immunizations, and we're finding that there have been some challenges in getting those appointments scheduled through Stride, and their public health nurse and I are working on some additional plans and some backup opportunities to better meet the need for immunizations, especially as we think about going into the summer and the school year starting in the fall, what that need might be looking like and where we might be seeing an increase in immunization access specifically. The other things that they've really been focusing on is behavioral health services. So you'll see in that report that there are, I don't remember off the top of my head because I don't have the report in front of me, but they've got over a dozen folks that have received behavioral health services, that report, yes.
You can come up and get it if you'd like to have something to talk from.
Sure, I'd be happy to.
This is your opportunity so the public knows what you've been doing.
I'd like to note that behavioral health services were not provided by our predecessor agency in this county. The only thing they provided clinically was immunizations in Douglas County.
Thank you, Mr. Hill. So with behavioral health services, there have been 8 individuals who have received that support. That could be through basic behavioral health screenings, could be a PHQ-9, which is the personal history questionnaire. It could be there's just a variety of different assessments and screening tools that their behavioral health provider uses. It's also connection to medication-assisted treatment programs. So we know that some of those individuals that are coming into Stride may have issues with opioid use disorders or alcohol use disorders, and the MAP program is something that can help them as well. So we're seeing folks that are taking advantage of that. They have been doing cardiovascular screening and diabetes prevention screenings. We know those are both important because those are part of our public health improvement plan. When you look under chronic disease prevention, both diabetes and hypertension are two of those priority areas within chronic disease. So we're really happy to see that what they're doing is taking that opportunity to screen those individuals and make sure that we're getting them to services that they need. We also have STI testing. So although Mr. Hill already spoke about the non-clinical community testing that we will be doing as a team, know that part of what we also have to do if folks test positive with rapid testing is that we need to get them in for confirmatory testing with a primary care provider. And so Stride can do that. What they also do is they actually do STI screening on all new patients that are coming into their system. So every Douglas County resident that we have that's going to seek services from Stride will automatically get screened for HIV, for Hep C, for syphilis, and then chlamydia and gonorrhea if they have indications that they need that as well. So these are all things we want to get our residents connected to as they need it. We continue to explore opportunities, needs in the community, and that's what we're looking at is as we get feedback from residents, we're always evaluating, is there something we could be doing differently? Are there other community partners in the area that we need to reach out to make sure that we are always bridging that gap in services as we identify them?
Thank you for that information. I spend a lot of time, I shouldn't say a lot of time, I monitor Twitter to see what's going on. It sometimes can be a good news source. Every once in a while, there's still somebody on Twitter that's attacking the Douglas County Health Department. And so I can get information and I respond to them and I always say, please reach out to me and let me know what service you need that we should be providing that we don't. And I have yet for anyone to respond to that. And that's why I wanted to give you this platform, because I think it's important for the public to see that although we're not spending as much money as had been spent, you all are doing a lot of good work for our community. All of you sitting back there, you are doing good work for us, and I want to give you the opportunity to make records of this so the public knows that we not only did a good job, that you all succeeded, and I'm very proud of what you do. Thank you.
Thank you, Commissioner.
One question.
Yes, Mr. Bracken.
Can anybody just walk in off the street and then, I mean, do they have to show identification? Could you just tell me about what that process is a little bit so I can understand
Sure.
who you're serving and how?
Yeah, that's a really great question. So Stride only has one brick and mortar location here in Douglas County. It's in Parker, right off of Parker Road and Cottonwood Drive. And that is the location that any Douglas County resident can receive services in. They can't just walk in without an appointment. But what we worked on with Stride was developing an individualized phone line. So it's a Douglas County number. It's 720-643-2403. That number, although it's a health department number, rings directly to their staff at that Parker location. So it comes across as a Douglas County Health Department call. Those folks at their front desk, as well as their public health nurse, will immediately pick up the phone, address our residents who are calling on that line, and then schedule an appointment for them as an established patient. So part of the challenge with any community health center is wait time, right? Especially if you're uninsured or you're undocumented. It is really, really challenging to get services when it comes to healthcare. Usually, a person that's calling on a regular line to get a new patient appointment could wait anywhere from 6 to 12 weeks to get a new patient appointment. We didn't want to have that happen to our residents, so that's why we worked to establish this phone line and have that opportunity to have our residents be set up as established patients in the system, which gets them in much, much faster. If they need immediate services, they can usually be seen within a couple of days. If it's something like a well child appointment or an adult well visit, it may take a couple of weeks, but it is not that 6 to 12 week mark that we would see with a new patient appointment. If they have, let's just say, an acute care need, so maybe they have an ear infection, maybe they've got strep throat. If they can't be seen as soon as they need to be seen at Parker. Stride has 3 different locations that has a convenient care center in those locations, which are walk-in services. So those folks can be referred to those locations. They're not in Douglas County, they're in Arapahoe and Jefferson County, but they can easily access that as well if they need acute care services immediately.
Are there any programs for transportation for folks that can't get to those locations?
That's a conversation that we've definitely had with Stride. One of my concerns, and I know Mr. Hill's concerns as well, especially for residents that are down here in Castle Rock that may have transportation barriers, is getting to Parker is not convenient. Getting to convenient care programs in Aurora is not convenient. There are not a ton of options when it comes to transportation. Obviously, if patients have Medicaid, there are transportation benefits within Medicaid for medical appointments specifically, and their staff can help those patients connect to that resource. That's part of the reason that we're looking and exploring other options and partnerships with primary care providers here in this community, as well as throughout Douglas County, is to make sure that if transportation is a barrier and we don't have the ability to get them connected to Lyft, to Uber, to a taxi, to Medicaid transportation, that we have other community partners that are willing to step in and help bridge that gap so that we're making access easier for those folks.
Okay. And then is that at the billing or CPT level, or would that be something that you would refer over like with a voucher plan, or what does that look like?
So from a transportation perspective, most of it would end up being vouchers. Yeah, we would have to do it that way. It would be CPT if it's Medicaid specific.
Got it. Thank you.
Because an Uber ride between here and Parker, depending on the time of day, $10. That's not undoable depending on the number. Anyway, thank you. That's really helpful.
Absolutely.
And Commissioner Thomas raises a good point that I think. I assume all this is being collected and is going into like an end of year accomplishments report to the public.
Yeah, we'll be turning out an annual report.
Yeah.
We're kind of waiting to think about that till further on into the year, but yeah, that's part of the plan.
Right. The year's going pretty darn fast too. That's what I've been noticing. It's faster it seems to pick up speed.
Wait till you're my age, yeah.
And really, if you think about the services that they're providing, they're keeping the hospital from receiving those patients and being another number that has to run through the state. So we're really saving money and time from the hospital side as well. So well done. Thank you very much.
Thank you. I do want to share a specific example that just came up this week to give you an idea of how we're trying again to help bridge the gap. We had a resident who emailed us and said, I reached out to Stride, I needed immunizations. They were asking me for an amount of money that I couldn't pay. What can I do? And so we got back to them and number one, explain that as a federally qualified health center, they actually cannot turn away patients for their inability to pay. So if she wanted to get herself and her children in for those immunizations, she could certainly schedule that appointment. By law, they're federally funded. They literally can't turn her away. But we also then turned around and said, here's some other options for you. CDPHE has a great free vaccines website that any person can log into, type in their address, and find providers who either have vaccines for children or have adult vaccines available for low or no cost. So we shared some of the ones in all parts of our county, whether it was here in Castle Rock, locations in Highlands Ranch, locations in Parker, and really said, here's some places that you can go. You can call your King Soopers Pharmacy, here's a pediatric office, and really just tried to help make sure that she had the resources that she needed to make the best decision for her and her family. So those are the different ways that we're trying to bridge those gaps for them.
Thank you. That's really helpful. Any other questions? Thanks. We will move on to action items now. We will move on to action items now. Director Hill, I believe there are 3 action items that I'll leave to you to detail for us.
Yes, sir, Mr. President. So First one is we had a request from the Douglas County Early Childhood Council to become their fiscal agent in place of the school district. And we have Diane Smith is here, who's the executive director of that organization, if you have any questions. But it's a fairly straightforward process. Human Services does this function for several organizations. So it would be a process whereby we would employ Ms. Smith and pay the bills of the Early Childhood Coalition, and then bill it, council, not coalition, then bill the state for those, get paid back, and we'd have the ability to recover the approximately 20 hours a month our accountant would probably spend on doing all this. So it's should be a no-cost project for us and a benefit to the community, and it's an organization that we work and partner with already.
Why are they switching?
I would let Diane come up and explain that.
Thank you.
Hi.
So I'm Diane Smith, and I'm the director. And I'm really the only employee of the Douglas County Early Childhood Council. There are challenges in working with the school district on a lot of levels. Many of the other early childhood councils throughout the state are connected to the health departments. So there's two sides to this. One, I really believe that the health department is an excellent fit. Laura and I have already been working together closely on some projects that we're trying to do. We're to support young children throughout the county. With the school district, it gives the impression to other child care providers, because we support all child care providers, and it gives this impression that there's favoritism towards the school district, that they, get whatever, more services and so forth. It's not true, but it is an impression that has been promoted. The other thing is with hiring, and we do have contractors who work with us, who are coaches, who are working with the new universal pre-K. Obviously, you can imagine that lots of those folks would be educators or former educators like myself, retired para-employees. One of the challenges when you have retired para-employees working as a contractor, you end up being punished because you end up having to pay both Social Security and para. So that creates additional expenses that then we're having to, in a sense, reduce funds that we could be giving out to our various constituents because we're having to pay me so I can pay those bills. So it's financial, it's perception, and I really think, most importantly to me, I think it's the organization that that we can work most closely with to the benefit of kids in our county.
Okay. Thank you. Any other questions?
So I'd be happy just to add that we have worked with Diane when Diane has been working to get kids in their preschool that was paid for by the state for 10 hours a week.
It's now 15.
Now it's 15 hours. Wow, see, that's why you're here to educate me. So we have worked with Diane on that. I know that the county is a fiscal agent for HIDA. That's a federal high-intensity drug trafficking area program. That is millions of dollars. I think when I read your packet, this is about $671,000 that we're talking about. Is that correct?
It varies. One of the things that's challenging to give you an exact amount is several of the funds the grants that we manage adjust based on the number of participants. So for instance, the Colorado Shines, which is the evaluation process for child care facilities, when people sign in and say, okay, yes, we'd like to go through the evaluation process, because it's not required, they then are given a certain amount of money. So that fund increases based on how many decide to sign on, and then, of course, it gets paid out. So it can vary a little bit from year to year, and then there's also the Emerging and Expanding grant, which can give up to $200,000. We don't have anyone that's asking for, yes, we have one facility that is asking for that much. So those kinds of funds can increase. I'd say our basic running, the main grants that we have is about $600,000, but it can adjust based on the needs and the uses. And quite frankly, I am thrilled that we have been expanding the number of our programs that want to be evaluated and prove that they're high quality.
Thank you, Diane. I have two questions for Mr. Hill. First of all, have you talked to Doug DeBoard, and does he think staff has the ability to do this? And number two, do you support this, and why?
So I didn't talk to Doug directly, but I did talk to Andrew in the finance office, and he's not enthusiastic, but he's supportive of this. And I think if Andrew is supportive, Doug is supportive, and we can't get it on your agenda without him being supportive. I don't think there's any problem. I also have worked with my staff to make sure they feel they can, because it's not going to be so much work on the county finance office. It's going to be our accountant getting in all these bills and putting it together and then sending a bill on to the state for us to get reimbursed. So I think the last communication I had from Doug through Andrew was that they're not enthusiastic, but they're okay with it.
Okay, I see Steve back here shaking his head. So this is something that you can handle? Okay. Those are my questions. Thank you.
Can I just make one comment about this? There's probably another reason in relation to the billing cycles of the school finance, which is far different from the billing cycles of county finance and can certainly be a lot more complicated in various respects as to how the school system allots its financing. I've been on the fiscal oversight for the school system in Douglas County, and I would say that the fiscal oversight, and I noticed that in the minutes too here in the packet, but the controls and the regularity of county government might actually make this much more efficient.
Excellent. Any other? Oh,
There was one other, I'm sorry. There was one other thing when I read this packet. So it says that the state law requires that decisions on using funds in the public health fund need to be made by the executive director and the Board of Health, or other Board of Health members designated to make such decisions, rather than always having to trouble the president. Using a finance committee will allow a smooth transition of business. So
You're skipping ahead.
I've got the wrong page here. Forget I said that. I'm sorry. Forget I said that. I apologize. I'm sorry.
nope. Thank you. So what do you need from us to do this? So this is just a review. You don't need any,
Well, so when it's review and consider, I'd like you to have a motion, and a...
oh, okay, so you're asking for a vote. All these are,
So
okay.
I'm trying to get away from me making all the decisions, because I'm not really supposed to make all the decisions. You all are my partners in making these decisions.
Okay. So if there are, so let's do this. Let's stop and take public comment before we go to a motion and a vote. I will ask if there's anybody in the room that has any comment on this item. Going once, going twice, we're done. Troy, are there any comments online?
Thank you, Mr. President. I have no online comment.
Okay. With the public comment process being open and closed, I would accept a motion to have the County Health Department become the fiscal agent for the Douglas County Early Childhood Council.
Is that your motion?
I'm seeking a motion.
He can't make a motion.
No, gotcha.
I'll make that motion, or is that what you were going to do?
Go ahead, after you.
I'll make a motion that the Douglas County Health Department become the fiscal agent for the Douglas County Early Childhood Council.
Second.
We have a motion, we have a second from Mr. Bracken. All in favor say aye.
Aye.
Aye. Opposed? Excellent. We have adopted that. Second item, Ms. Larson, if you would come up, a request to add 2 additional community health educator positions.
Thank you, Mr. President. So if you're not already familiar with our community health model, we actually have 3 community health educators, and their priority areas currently are chronic disease prevention, fall prevention and healthy aging in older adults, suicide prevention, substance misuse, STI prevention, and tobacco prevention and education. That's a lot of really exciting work that we do. It also requires a lot of time and effort on the part of our 3 community health educators. As part of 2 grants that we have a proposal in front of you for the addition of 2 community health educators to the mix. One is specifically for our tobacco education and prevention program, the STEP grant. That grant cycle for FY24 starts on July 1st, and CDPHE has already approved the addition of 1 more community health educator that would be solely focused on partnering with Elbert County, because part of the work that we do in tobacco prevention is to support Elbert County as well. So that individual, if approved, will be working directly with the community health educator in Elbert County to work on what we are required to do in this grant, which is called a community-focused tobacco profile. It's a requirement for a grant. We have to do this program and this profile for both Douglas and Elbert County. And so having that additional resource in that community health educator will help ensure that we can meet that need on the profile in Elbert County specifically. All of that funding is actually paid through the grant, so there's no county dollars or costs associated with that. In your write-up, we give you the range of what that community health educator is. What was approved by CDPHE was a total budget of $79,950 for personnel and fringe benefits. So that's an average of about kind of the mid-range pay, which is $60,000 per year for a community health educator. So that is one position. The other position that we've put forth for you is a community health educator specifically focused on immunizations. So thinking of just common standard child and adult vaccines specifically. Although we're contracted out with Stride to do immunization services, there's a significant amount of work that has to be done on the back end as far as data reviewing, reporting requirements to CDPHE on child care facilities, schools. Are they reporting their immunization data on time? If not, what's the follow-up to that? We also are required to do quite a bit of education around immunizations. So that could include vaccine hesitancy. It's including information on flu vaccine as just kind of an annual campaign that we have to do. But there's a lot of education that has to be done with policymakers, with our school boards, our schools in general, child care programs, and the public at large. So we're really looking to add that additional community health educator that would be 100% focused on that work on the immunization side as well. That range of pay, also the same thing for that community health educator. And the immunization grant that we have would also help cover that. The funding that we receive for immunizations is actually a quarterly disbursement of funds. There is no budget attached to it, so we have quite a bit of flexibility in how we choose to utilize those dollars. The total grant funding starting in July is $299,015. A portion of that does go to help cover the cost of services that Stride is providing, but there's ample opportunity to utilize funds from this grant, or in partnership with Mr. Surbeck, the ALC 2.1, we've also looked at utilizing his funding as well to help support the cost of the FTE for this, so that we can partner on any kind of messaging that we need to do around COVID vaccines. So those are the 2 positions that are up for discussion.
Thank you. That's really helpful. I have some, so immunizations are very important, and I've always been a supporter, and I am. The immunization education can become a fraught area, particularly if people think that we're not providing information, but we're information on pros and cons, or let me say that's not even right. On the potential downsides of immunization and the side effects that could occur from them, which I personally believe immunizations have been one of the miracles of public health over the last 60 years. You eliminate polio, that's a big deal. We had eliminated polio. How do you handle the educational aspect of this? And do you provide people, obviously this is a decision between them and their healthcare provider, but do you provide people the information that, along with the potential, side effects that we know that immunizations could have? Is that part of the process?
Certainly, and I think it goes back to what Mr. Hill has said in various meetings that we've had with you over the course of my time here at the health department. What we really are here to do is help inform. We're here to help give education so that our residents can make informed decisions for themselves and their families. Not trying scare tactics, not trying to convince person to do one thing over the other, but really making sure that they have both sides of that information. Some of the ways in which we've already started doing that is through our website. So I know you all have seen the health department's website. We have an entire section specifically on COVID. Fallon and I work regularly on the types of messaging that we're putting on the website, especially related to community health or those types of messages around vaccines. So she does a really great job of putting that information out there and making sure that people know the different types of resources they can go to get additional information. We're doing the same thing right now with standard vaccines. So if you go to the community health page, scroll down to immunizations, you're actually going to find a variety of information there. We include hyperlinks to the CDC's recommended vaccine schedules for children, youth, and adults. We have information on flu vaccine. We have information on where to get free vaccines. We're really just trying to put the information out in front of people. And I think that's really just the way in which we're always looking at that within community health is how do we help provide that perspective? If people have more questions, they want to know more in-depth information, we're happy to give that to them. But how do we make sure that we've covered the bases so that, again, they can make those informed decisions? And that can be done through our website, through one-page handouts, through talks and presentations that we're doing with community partners, with flyers that we might send out to childcare programs that Ms. Gappa and her team work with. There's a variety of different ways that we can get that information into the hands of the people who need it.
Thank you, and thank you. Your answer was better than the question, and I appreciate that. Because we are seeing vaccine hesitation now, and I'm not stating that from a political perspective. I just think the numbers I've seen indicated is a fact. And this is my opinion, part of the hesitation people are having is the belief that they weren't fully informed in certain circumstances with respect to certain, vaccines that they were being asked to get. Therefore, I think it's incumbent upon us to do exactly what you said. We're providing you the information for you and your family, and then you will make the decision, and hopefully in consultation with their healthcare provider that we hopefully they trust about what step to take next. But I think if we're perceived as being advocates, I think that's not going to work well, and that's going to increase, I think, what is already an abnormally high number of hesitancy. We talked about polio. I read some time ago that instances of polio being picked up in wastewater now in New York City, and that's bad. That's really, really bad. And what we need to do in our little part of the world is make sure that if that exists here, we're remedying it. If it doesn't exist here, we don't create it. The second question I have is really for you, Dr. Hill, and I think this is more of a strategic planning question. I just want to put it on your radar screen. Tobacco's bad. We all know tobacco's bad. We all know tobacco's been bad now for 65 years at least. We have a lot of money that goes into tobacco education to remind people of what they already know, that's tobacco is bad. And at some point, I just want to have a conversation about how we decide what grants we go after. All grants aren't made equal, and just because money's available, and I'm not saying in this case, I'm just speaking broadly now, that perhaps because a grant exists that we don't need to go after. We were just talking about fentanyl. We have a huge, from listening to you, we have a huge educational hurdle to overcome with respect to telling people that grabbing pills at a party out of a bucket is a stupid idea. So maybe if there were a grant there that we could go after, it would be important. And if it's a matter of staffing issues, then we should be making some prioritization of what we're going after. Not talking about the tobacco grant, though. We have known tobacco is bad for a long time, and I think that's well ingrained in the American public's mind. So I just want to make that point.
Yeah, and I would tell you that I think we don't apply for just every grant that flies by, because many fly by that we don't apply, but part of the reason for item H is to get a finance committee, especially if we go to quarterly meetings, so that I have some smaller group that I can nimbly call together, because some of these grants come up, it's like, oh, okay, here's a grant, that will apply by Tuesday.
Right.
So there's, if I wait for a meeting, then it's a problem. So I'd like to have a group that I could get online with, not necessarily come into a meeting, but get on a Teams call, hey, here's this grant, you representatives of the Board of Health, what do you think, should we apply for this?
Okay.
So there's some method in the madness here.
Mr. President?
Oh, yes, yes,
The
ma'am.
only other thing I would add to that is that we're also really trying to be strategic, especially with our partners over at the Mental Health Initiative. There are a significant amount of opportunities when it comes to trying to address any behavioral health concerns that we see here in our community. And so we've really taken that opportunity to find ways to partner and collaborate with them on applications that they might be submitting. We're receiving application opportunities and taking the time to really dig into the details and review and determine whether or not opportunities they're seeing may be a good fit for the health department as well. So that's just another way where we're really trying to strategically work with our other community partners in that arena.
Thank you.
Well, the other thing is, if I may, so before COVID, I was working with the Tri-County Tobacco, Anti-Tobacco, whatever the title was, right? And so I was able to connect him with the school resource officers, because I think the number was like 60% of teens are vaping with nicotine in high school and below. So that is, entry level, 14, 15-year-olds, all the way up to seniors. And so, I mean, that, connecting them into the school resource officers, for example, and then, gaining audience that way was a strategy before. So perhaps that could be part of it.
And we're actually already working on that as well. So we're connected with the school resource officers right now. We had also been working with the health prevention team over at the school district that's focused on student wellness. They've had some changes to that structure in that team, but that was also part of the conversation we talked about with them. A really alarming statistic that they gave us a couple of months ago was that they're receiving qualitative data, not by numbers by any means, but qualitative reports of students as young as 4th grade vaping in school bathrooms right now in our schools here in Douglas County. So we know it's an issue, and it's an area that we absolutely want to continue to focus on. We do have a meeting that we're trying to get scheduled with the school district here in the next couple of weeks before school is out to continue those conversations on how can we best come in and help address that.
In school, helping set school policy. I mean, a kid gets busted with a vape pen or whatever, getting in trouble for it likely isn't going to be the change. It's going to be the education around why they should make that change.
Yes, and we've talked about that. We've also just recently had a meeting with the teen court in the city of Lone Tree, and really taking a look and evaluating the cases that are coming through teen court and how our community health educators could come in and provide some education to those students. We know that punitive measures are not always the most favorable measures with young people who don't have a lot of activity happening yet in their frontal lobes because it's not developed. And so really trying to help provide them information, education, resources, and just people that will sit and help listen and try to help guide is another way in which we're going to try to address some of that you're mentioning, Mr. Brecken.
Thank you.
Any other questions, comments? Then I would request a motion to add 2 additional community health educator positions.
A motion to add 2 community health educator positions to the Douglas County
I'll second it.
We have a motion and a second. All in favor, say aye. Aye.
Aye. And I'll just clarify, this still needs to go to the county commissioners for the final hiring, is that correct?
Yeah, absolutely. I mean,
So this is
it's
a
two-step
recommendation.
process. It
Right.
goes to you, then the BOCC.
Let me back us up a step here, because this is my fault. We have not yet taken public comment on this. So let me back up, and before we certify the vote as being official, let me see if there's anybody in the room that would like to comment on this. Sir, Troy, do we have anybody online that would like to comment on this?
I have no online comment.
Okay, thank you. So then, but and let's just to make this clean, let's do it again. I will accept a motion to add 2 additional community health educator positions.
I move to add 2 educator positions to the Douglas County.
I second that motion.
Okay, we have a motion and a second. All in favor, say aye.
Aye.
Aye. Opposed? Excellent. Director Hill, I would go to forming a finance committee.
Okay, so last request of the evening, and this comes kind of a two-pronged issue here. The first is that when we first formed the health department, the state gave us a little minus by our name because we didn't have a Board of Health Finance Committee. At the time, I wasn't sure that with a 5-member Board of Health, we needed a committee to be doing something separate. But now, as we're decreasing our meeting frequency, as I mentioned earlier, there's a need sometimes. It's not going to be every week or every month necessarily, but there's going to be times when I need Board of Health input to make a decision on something financial, whether it be a grant, accepting a grant, applying for a grant, some other financial change that has come along. So I'm agreeing, finding myself agreeing with CDPHE that we should have such a committee at this point in time.
So how would the committee work? Would it be providing approval to apply, and then the full board would approve the grant, or the commissioners would? Structurally, how would this work?
Everything we do financially has to go to the commissioners afterwards, so I'm just trying to take care of our end of the process. So what I envisioned here was that the committee and myself would come to a decision, move forward with it at the next regularly scheduled Board of Health meeting. You all would have to ratify or fail to ratify what we had done.
Okay. And there would be 3 members on the board?
I was suggesting, well,
How-
it's up to your board. This is kind of a late breaker that I added on to the agenda as I was sending it out for review. If it gets to be more than 3, then that's a quorum of the board, and we were having a meeting already.
And if it's 3, then you have a majority. I would probably recommend 2.
Yeah, so keeping it less than a quorum makes it a committee.
And less than a majority, or else, I would, anyway, I would, so what do we need to,
So, I mean, if we can just vote tonight on the establishment of the
Okay,
committee,
and
then
then
I
you'll
can work
handle-
with Mr. Pratt
Okay.
to come up with some bylaws,
The details.
suggested bylaws.
Yeah.
And then you can get, talks amongst yourselves and propose who would be the members of this committee.
okay, that actually, is that everybody, I'll open up to comment. Yes, Commissioner?
So this is where I got confused earlier and made a fool of myself. It says here that the state law requires that these decisions using funds be made by the director and the Board of Health. So would this finance committee take the place of the Board of Health?
What the law says, it has to be made by me and the president of the Board of Health, or such other members as are designated by the president.
It does say that.
So that's,
Okay.
yeah.
I just needed that clarification.
Can I just ask one question also to clarify? This means it has to be a subcommittee of the Board of Commissioners, or can outside people, say if you had somebody that was knowledgeable in a different area, could you use somebody on this committee who is not on this board?
That's a good question.
I'm going to look to my friend to the left here.
The one from Michigan?
I'm the one from Michigan. He's
I would say it's unclear, and so it's possible that there could be some discretion to do that. I think the point of having members of the board do it is that it would be that much easier to approve as a board if if you're using members of the board to already be informed on that issue going forward.
Although if you have, say, 3 people, then you're taking the majority of this board already. So what I would be thinking is, if there was somebody, say, with the financial or grant expertise that could add something to the discussions at the discretion of the people here, that might be a valuable addition. And so you have 1 or 2 board members, but you also have a little broader representation.
Community representation.
Yes.
What I'm hearing, though, is, so if I can, I think I have a thought. So what you're asking us is to form like a shell, to approve the concept, and then you will come back to us and say, here's how we would like it structured, and whether we need to, and we can figure out later whether we need to vote on that again. But you want to form a finance committee. I think we would, I think I'm seeing general agreement with the concept. I think what members want are the available options as to what the makeup of the board could
Yes.
look like.
So, I mean, and what it says basically is that it's you as the president or
Right.
whoever you delegate. So if you're
Oh.
comfortable delegating people who are not Board of Health members, I guess that's okay, but I think the intent to me appears to be that it be Board of Health members, but I guess it doesn't explicitly say that.
Well, it doesn't really matter, because ultimately, we have to vote on
Well,
it,
you-
so,
you-
yeah, so it's like we could appoint anybody.
I think you could look at this as being in lieu of a special meeting called just to approve financial matters as they come up, because the law doesn't require this body to meet more than once every 3 months.
Right.
That's the minimum. You can meet more, and we have. And so for us, this may seem a little foreign, but the law only requires you to meet once every 3 months. But there may be financial issues that come up in those 3 months that require more immediate action. And so this is a tool that the state recommends Board of Health set up so that they can have that quick reaction to financial matters as they come up. The alternative would be, as I said, the board can have a special meeting called at any time, but that can be onerous to have all of you meet for a special meeting. And so this is kind of an alternative to that.
Like, okay, Mr. Bracken, you're recognized.
So for example, let's say there was a grant that was coming up and you needed to snatch it up before it went away and somebody else used the money. So the board, the financial board would then approve and accept that grant and/or process it, and then it would come to the Board of Health for approval after that time, or are they now the approval arm?
No.
So the issue here is getting approval to apply for the grants, because it
Right.
was mentioned earlier, are we applying for grants willy-nilly? Well, we're not, but let's have some validation to that process. So this group would say, yes, it's okay to apply. The Board of Health could still say later, oh, you guys are out of your minds, we're not going to do that, and we just go back to the granting person and say, never mind, we withdraw our application.
So
But at
what
least
I,
that we're in the process.
what I'd like to suggest to my colleague, Dr. Fielding,
Yeah,
I'm
I
sorry.
have one other thing. You have a larger pool of applicants for this, if you want to keep it within the board itself, because we all have alternates.
Yeah, exactly. What I'd like to recommend we do in this is, one, approve this today. I understand that it would be my option to delegate who would serve on this. What I'd like from you all, though, is some options and some options, what's available to us, some recommendations, and then I'd like to bring this back, not for a vote, but for discussion of the board at our next meeting or the meeting after, whenever you want it done, because I want to make sure because Dr. Fielding's idea, I think, is a really good one, and there may be other good ideas that pop up out of this. So that is what I would recommend that we do. Are you good with that?
And I like the idea of using the alternates because they've been through some kind of vetting process already.
Yeah.
They don't have had to go to the Board of Health training like the rest of you had, but at least they've been vetted to some level and approved by the county commissioners.
Right, yeah, and that's, come up with those options. They'll think broadly, too. It could be somebody from outside at the hospital, or, who would be, one, who could we engage that would, that would be maybe perhaps somebody we're not engaging right now. How can we use this as a sort of a community outreach tool? Maybe it's a mixture, maybe it's more, maybe we have one, maybe two board members, and maybe we have 3 or 4 outside folks on it as well. So if you would just come back with options along those lines that we could discuss, I would appreciate it.
Okay?
Anybody, is that okay with everybody?
I'll just add that we can't have 2 county commissioners on that because that would make a quorum and then we'd have to post it.
Yeah.
And if the purpose of this is to keep from having to bother the president and get a quick response, bigger makes it more difficult to get it pulled together as well. Just a comment.
Yeah, that's why I suggested 2 or 3 with my
Right.
leaning being toward the 2. And I put in there that we would make the ability to have virtual meetings, so I don't have to corral people in. We just get a quick call and say, hey, here's what the issue is, what do you think, and move on.
And I don't mind being bothered, but I don't know that, all of this should rest with the president either. I think that it's something that should, it's something that should be spread out. It should be a diffuse sort of authority so we get the best options. It's just, me and Michael talking about it, I don't think is as good as Michael and, Dr. Fielding or Kim talking about it. And with maybe 1 or 2 other folks, and then making recommendations. I think better decisions are made by broader groups, not too broad though, so that it becomes unwieldy.
Yeah, unwieldy was the word I was going to
Yes.
toss out there.
Yes. Okay. So let's go to public comment on we have public comment in the room. Thank you.
Good evening, everyone. And again, thank you so much for all of this great information. It's so exciting to see the direction this board has gone and the work that's being done. And this particular suggestion really looks like it will be able to expedite the process of accepting grants and look at things in a more specific and detailed perspective if you do this offline from a board meeting. And what I would say is that I think it's a great idea. One thing that I would have you consider, though, is it probably won't speed things up that much if this finance committee has to wait for a quarterly board meeting for things to get approved. It might be that you might still need to have a quick roundup of the board at a virtual meeting to approve it. So in your packet of considerations of different options, maybe think about how that might work from a logistical perspective. And then, I do know that, my perspective of committees is that if you have the committee too small, it then becomes very small groupthink, and you're not making maybe the best and more diverse discussions and options that might come to mind if you have 3 and sometimes have an outside person to be coming in to provide that outside perspective. And particularly if this is specifically or more usefully for grant submissions, that's probably an expertise that you might want to look for outside of this board. And selfishly, I'll throw my name out there as somebody who's had a ton of experience reviewing different types of grants out there. They are not all equal, and there are lots of hooks in many of these grants that aren't worth the effort. However, there are many that definitely are worth the effort, and you need somebody who can look through the actual grant application and point out what those issues are, because that's what you guys want to know when you make the final decision. You want that small committee to be able to say, this is a great idea, and these are the pros and these are the cons. Otherwise, you can't really make an informed decision on it. That's all I have. Thank you.
Thank you.
Can I make
yes,
a couple of
Dr.
clarifying
Hill.
comments?
Yes.
So it's not that the Finance Committee would then go for approval to the Board of Health, but the Board of Health could overturn the decision of the committee and myself if they want to. So it's, the decision's made, we're applying for the grant, we're putting in whatever budget request we did, And it's not just about grants, it's about any kind of financial matters that so far I've been making the decisions. And occasionally when I feel I need to, reaching out to the president. This is just to formalize everything that's financially related so that it's not just one person making the decision or necessarily two people. So it's not that this committee is going to have to wait for the Board of Health to approve it.
Oh, okay.
It's just that the Board of Health could come back later and say no and undo what we had done, so.
So you could apply
Barring
anyhow. and-
disapproval, yeah.
Gotcha.
And it's-
Okay.
and I'm not envisioning this as a group to evaluate grants in detail. I mean, we would do that and bring a proposal, here's the grant, here's why we think it's good, here's why it might be a problem, and then looking for input on the decision.
Okay.
And not to be having a discussion with you, just,
Yeah,
but to make
no.
sure that there's clarity in what we're trying to accomplish.
Yeah, awesome. Thank you for the clarification.
And then again, after the Board of Health approves it, it still needs to go to the Board of County Commissioners for final approval.
Right.
Yeah, I'm just looking before I take it to the commissioners that I've got support of the Board of Health.
Layered support.
And I would agree with some of the comments that were made about the grants. When I reviewed the Tri-County Health Department budget, their largest spend was teaching lactating mothers, and they really need that many, that to be their largest spend, and the hospitals can't supply that services. So I think that they were grant grabbing in a lot of cases, and then really just tucking them underneath their system, and that's why the spend was so large.
Yeah. Yeah, the grants shouldn't drive the work. The work should drive the grants.
Actually, we're.
Oh, sorry.
Thank you. So a couple of things. One, I would recommend approval of this based upon what we talked about, and that we'll be coming back and having a discussion about the makeup and the role of this group. I think that for me, this isn't about whether it's easy for me or whether, frankly, I'm really hard to get in touch with sometimes, and so that Michael, may worry that there could be an opportunity that I'd miss because I'm traveling or Lord knows where I'm at. I think this is more about, and there's going to be a tension in this, this is more about, I think, spreading out the decision-making authority of this board to an appropriate extent so that we get the best review and best input on what grants we should be going for. One of the things that is going to require of us, and I'm sure that this is going to be embedded in the strategic plan, is, what is our focus, and where should we be proactively looking for grants, and what are areas that we're, frankly, as we talked about this and we split from Tri-County, areas that frankly aren't a priority for Douglas County, maybe something in other counties are looking at, but are not a priority in our county. And that would serve as guidance for the review committee to take a look at the grant and say, yeah, it's available, yeah, we may actually be able to get it, but no, it's not something that is a county priority, therefore we're not going to go after it, and instead, so serving sort of a vetting process. To me, that's the real value of this. It's not so much whether it's, I can be gotten in touch with, or whether or not it's a hassle. It's more of, I think, spreading out and getting the best opinion, including from community members. I think Dr. Fielding's suggestion is a good one, and we'll just have to structure that so that there is the appropriate balance between, something being awkward to manage and not being diverse enough so that we don't get the right views. And I'm sure we'll strike that balance. Any other thoughts on this? Did we take public comment on this? Yes. Sorry.
We didn't close it, though.
Yeah.
Did you ask online, though?
I think I did. But let me ask again. Troy, is there anybody online that wants to comment on this?
No, sir, I have no online attendees.
Okay. Thank you for not saying still. So I would accept a motion to form a Board of Health Finance Committee. Of course, the subject to everything that we've discussed here and will be on the agenda in the future. Do I have a motion to form a Board of Health?
I'd like to make a motion for Douglas County to form a finance committee.
Thank you.
I'll second it.
Thank you, Dr. Peel. I could feel you wanting to second it when I looked at you. All in favor, say aye.
Aye.
Aye. Opposed? Thank you. Now we're on to the citizen comments section. Are there any comments in the room, general comments in the room on any matter? Troy, is there anybody online that would like to comment?
No online comments, sir.
Excellent. Any other comments from the board? Yes, Commissioner.
So I don't see anything here about new business or old business, but I have received questions, and so I would just like to be able to put this on the record, and I've reached out to Mr. Hill. People have reached out to me about teachers dying of meningitis or something, and was there anything like that in Douglas County that we should put on the record?
So a teacher in Arapahoe County died of meningococcal disease. Close in time, 2 other teachers, both working in Arapahoe County, died not of meningococcal disease. One of those teachers had as a symptom meningitis, which is not the same thing as having meningococcal disease. This caused a bit of a perturbation in the force because people got the idea that these 3 teachers all died in close proximity of time and that they must have the same thing and there's a big outbreak going on. But there was no such thing. There was one person, and it was handled appropriately by Arapahoe County. And the person who resided in our county but worked in Arapahoe County did not have meningococcal disease. Just an unfortunate coincidence.
Thank you. I think it's important to have that information out there because I received a few calls and comments about that, so thank you for that information. And then I have one for the president.
Yes, ma'am.
We had talked about maybe an action item review or anything, something like that. Are we still considering something like that?
Yes, as a matter of fact, Holly Carroll and I are working on it. We have an after-action review of COVID and how the county responded, how the state responded, and how the federal government responded in helping the county manage COVID. Holly and I have been talking. We have meetings scheduled weekly. We skipped today's meeting because we have an RFP out now. We've spoken to Larimer County about it, and actually it's really interesting to talk to Larimer County. So we have an RFP out for somebody to do this work, 1. 2, we spent, it must have been over an hour talking to the Larimer County Health Department about, they did a similar review that they just finished, and one of the things they said is, I think they did theirs late last year, and they said, you're probably in a better position to do yours a little bit later because we were finding that there was some fatigue and people didn't want to really engage because it's like, okay, aren't we done with this yet? And they feel that we may be getting a better response. They came up with several recommendations, including recommendations, some recommendations that they think we'll have as well with respect to not only how they handled it, but also how the state handled it. And we talked about, once we complete ours, sitting down again and perhaps sitting down with some other counties and coming up with maybe some joint recommendations that we would all go to the state of Colorado with and say, here's what we found, here's some things you could do to assist us in something in the future, and perhaps have some affect some greater change, not just at the county level, but also at the state level. So it was really, there's really been some nice work going on in this, and so thank you for asking. I was a little tardy in moving on this, but we are now full bore on it, and we're going to be doing something very quickly, and I think it will serve a lot of benefit to us to take a look at it. I think a lot of benefits for the healthcare providers in the county, but I think there's also going to be a benefit for those who in the future that may be dealing with the similar circumstances will have the benefit that we did not have of being able to pull something off the shelf and say, what did those guys do? What did they do well? What did they do poorly? And let's adopt what they did well. Let's not do what they did poorly. Super cool. And Holly's been great, by the way. I can't say enough good things about her and how competent she is. So.
And Holly is always very competent in whatever she does. So thank you for that information. And I would just like to point out to everybody how really fortunate we are here in our Douglas County Health Department that we have a president in Doug Benevento who was the president of this, who was the executive director of the state's Public Health and Environment Department. You know, you have brought so much expertise and knowledge, and even if you think about some of the questions he was asking today, we can really see his expertise coming through. And so as the first president of this Board of Health, thank you for everything you bring to us.
Oh, that's very kind of you. Thank you. And I'm only here because the commissioners were wise enough early on to say we need to form our own health department. So thank you. I appreciate that. With that, I will accept a motion to adjourn.
A motion to adjourn.
I'll second.
All in favor?
Aye.
Aye. Opposed? We are adjourned. Thank you very much.